Welcome to Oklahoma Health Matters. Today, we're exploring how physicians can ethically and legally recommend medical marijuana via telemedicine under Oklahoma's laws. Let's start with the basics. Question: who may or is authorized to recommend medical marijuana through telemedicine in Oklahoma? Answer: first of all, the physicians, MDs, and DOs must be Oklahoma licensed. Second, they must have an active DEA license for controlled substances. Third, they must hold a valid certification from the Oklahoma Medical Marijuana Authority, OMA, to recommend medical marijuana. It is important to note that out-of-state physicians cannot recommend unless they are licensed in Oklahoma. And the telemedicine platforms must comply with state licensure rules. Finally, Oklahoma's Telemedicine Act, 63 OS 4920.2, requires providers to be licensed in the state where the patient resides. Question: how does a clinician remotely establish or create a valid physician-patient relationship? Answer: there must be a real-time interaction with a synchronous live video visit and no chatbots or pre-recorded Q&A. A medical evaluation is required, including a review of medical history, symptoms, and prior treatments. Oklahoma allows telemedicine for follow-ups and renewals, but the initial visits may require stricter documentation. The clinician must document the patient's qualifying condition, e.g., chronic pain, PTSD. Question: the next question is about informed consent requirements. What must physicians disclose? Answer: the clinician must disclose the risks versus benefits, discuss potential side effects, e.g., cognitive impairment, dependency, and therapeutic goals. Next, disclose the alternatives. Mention conventional therapies, e.g., NSAIDs, antidepressants. Disclose the legal risks, federal illegality, workplace policies, and DUI laws. And document. Use a signed consent form stored securely in the patient's EHR. Question: what about recording the encounter? Are audio-video recordings mandatory? Answer: yes. Oklahoma law requires telemedicine visits to be recorded and stored for 7 years per OAC 435-30-19. And HIPAA compliance is required at the federal level. Use encrypted platforms like Zoom for Healthcare or Doxy.me, among others. As to the content, be sure to capture discussions on diagnosis, treatment plan, and consent. Question: let us turn to educating patients on risks and benefits. What should patients know about cannabinoids? Answer: discuss the therapeutic uses, for example, pain relief, anxiety reduction, and improved sleep. Explain the adverse events including dizziness, dry mouth, anxiety with high THC, and drug interactions, e.g., opioids, blood thinners. In special populations, warn pregnant patients, adolescents, and those with schizophrenia about significant problems. And provide the patients with resources, for example, online educational videos, ALMA's patient handbook, or direct them to reputable sources like Project CBD. Question: the label on purchased cannabinoids often includes a certificate of analysis, COA. How should patients interpret or read the COAs? Answer: first, the patients should look at the potency. Look for THC CBD percentages. The patient should always start low, e.g., 5 to 10 milligrams THC. Next, look at the contaminants. Ensure pesticides, heavy metals, and microbials are below state limits. Terpenes, flavonoids may be noted. Explain their role, e.g., myrcene for sedation, limonene for mood. Finally, check the name of the testing lab. Recommend labs that are certified by ALMA, e.g., Botanicor, Steep Hill. Question: okay, let us talk about selecting cannabinoids and formulations. How does a clinician personalize treatment with cannabinoids? Answer: THC versus CBD. Use CBD-dominant products for daytime, minimal psychoactivity, and THC at night for sleep. As to ratios, 1:1 THC-CBD ratio for neuropathic pain, and high CBD, 21 CBD-THC for anxiety. There are many delivery methods. For example, vaping has a fast onset for breakthrough pain. Edibles and oils are longer lasting for chronic symptoms. Terpenes are important. Use pinene for focus, but avoid it in anxiety. Caryophyllene helps inflammation. Question: what else should clinicians know? Answer: know the legal limits. Patients can possess up to 3 ounces of cannabis and grow 6 mature plants. Patient OMA card renewals are important. Telemedicine is permitted for renewals every 2 years. The clinicians should avoid liability. Never recommend doses exceeding 1,000 milligrams THC month without justification. Question: any final advice for providers? Answer: stay updated on OMA guidelines, prioritize patient education, and use telemedicine to expand access, especially in rural areas, and visit ALMA's website for the latest rules. Thank you for listening.